Good afternoon. Thank you all for being here this afternoon. I'm very grateful to have all our partners in this endeavor represented here today from the City, County, El Paso County Health, our hospitals, and our first responder agencies. Ladies and gentlemen, a coordinated response involving all these agencies helps ensure the best possible service to our community. With us today, we have Commissioner Mark Waller. El Paso County Medical Director Dr. Robin Johnson is joining us technologically. We have the Associate Chief Medical Officer of UC Health Memorial, Dr. David Steinberg. We have Dr. Brian Early, CEO of Penrose St. Francis. We have Dr. Bill Plouth, Chief Medical Officer for Penrose St. Francis. We have Jim Reed, the Emergency Management Director for the Pikes Peak office of OEM office. We have Brian Robeck, the Parks Director of El Paso County, and Karen Polis, the Parks, Recreation, and Cultural Services Director for the City of Colorado Springs. Ladies and gentlemen, no question these are difficult and uncertain times, and the circumstances surrounding the COVID-19 epidemic have been rapidly evolving. Just yesterday, they evolved considerably when Governor Polis issued a stay-at-home order. And we know there are lots of questions regarding that. We're here to try to provide some information and clarification on these issues, as well as provide some information about how our community continues to prepare to deal with the epidemic. First, I want to reassure our citizens that your government and your medical agencies and organizations are working hand in hand daily. In fact, multiple times a day. We're communicating constantly to ensure we're acting on the most current information and data. And we're attempting to put in place policies and resources to ensure our community responds appropriately in the interests of public health. Yesterday's order from Governor Polis is the latest response on a state level in an effort to flatten the curve, a term that we've become very used to at this point, but essentially to keep our community safe. The order significantly raises public awareness. It also provides some guidance on what is and is not open. While it is a stay-at-home order, there are a number of exemptions from various personal activities and for the continued operation of critical businesses and, of course, government. Under the order, many businesses in grocery, pharmaceuticals, banks, health and human services, and other critical businesses are exempted from the order. This is important, and people can be assured that these services will go on. Restaurant pickup and delivery can continue. Outdoor activities are allowed, like hiking or biking, and I'll comment a little bit more on that in a moment. First and foremost, I would encourage all our citizens to actually look at the order. I know you've gotten some text from the state and it says stay at home, but I think it's important to look at the order and see what the exemptions are for your personal activities and for critical businesses. That order can be found, and this is the Colorado Department of Health and Environment order, can be found at COVID-19, covid19.colorado.gov. It's a 13-page order, and I encourage all our citizens, you're at home anyway, might as well go on the computer and read that order. As we stated yesterday, our parks are still open, and these can be a wonderful asset for maintaining mental and physical well-being. By all means, you can leave your house to go out and hike, bike, jog, or recreate responsibly and while observing social distancing. Please note that now use of playgrounds and organized sports are prohibited. No impromptu basketball games or soccer games, things like that, in our parks. We're posting closure notices on our playgrounds, but folks, we'll need all of your help in complying with these closures and these orders. To be clear, this stay-at-home order from the governor is not a suggestion. It's the law. But I think I will be joined by El Paso County in saying on behalf of the city that first and foremost we must rely on voluntary compliance if we want to see the spread of this disease significantly impacted by this order. We simply do not have the law enforcement resources to man every park, every trail, over every open space, every small business in our community. We don't have the resources to do that. We are redeploying school resources officers and park rangers to our parks to educate and discourage gatherings and other unsafe behavior. But the truth is, we need everyone's cooperation. There will be a process in place to enforce these orders criminally if necessary. But that's a last resort. We do want to get voluntary compliance, and we sincerely hope we do not need to make this a law enforcement activity. People will be warned about their behavior. If necessary, they'll actually get a written warning, and only after that, with the cooperation between the health department and the district attorney's office, will any charges be brought. So there'll be plenty of opportunities to rectify any behavior that's in violation of these orders. Please understand the gravity of the situation and do your part to help us stop the spread of this disease. If you have any questions, and we know that many people do, we have a public call center available, 575-8888, to field questions. Let me repeat that. We have a public call center available at 575-8888. And as I said earlier, the governor's stay-at-home order can be found at covid19.colorado.gov. There are also a number of online resources that can help answer your questions. For the city, those are listed at www.coloradosprings.gov/COVID-19. I want to reiterate, we will get through this. It will be painful, but we will get through it. But we need your shared responsibility, and we need your shared sacrifice to get through it sooner than we otherwise would without that responsibility and without that sacrifice. So I ask everyone to do their part. Now I'll ask County Commissioner Mark Waller to give the county's perspective.
Thank you, Mr. Mayor, and thank you to all of the citizens in El Paso County for to help us manage this crisis and get through it. A little note for housekeeping here. We are broadcasting this live on the county's Facebook page now, so it's on Facebook Live, and we will be taking some questions from Facebook Live and answering those at the end of the press conference here today. So if you have a question and want to submit it, we may be able to answer that for you. First and foremost, from the county's perspective, the governor's order didn't change anything from what the county is doing. We are still open for business. We have many mandated services that we are required to provide, whether it's through the Department of Human Services, through our Department of Motor Vehicles, or even through the land use planning process. We have numerous services that we are required to provide, and the county is still open for business. Almost all of those services can be provided online. Let me say that again. Almost all of our services can be provided online. You can go to the El Paso County website to get answers there and to be able to find the resource you need in order to get your service taken care of. That's elpasoco.com. Again, elpasoco.com. And in the rare circumstances we cannot provide a service online, we will be able to, through appointment and other means, be able to provide those in person, whether it's at the Citizen Service Center or at any of our other numerous county buildings throughout the county. Now, I want to be clear here and echo what Mayor Suthers said, and that is our parks are going to be open as well, making sure that we're not closing those down at this time, and it's our hope that those don't have to be closed down as we move forward through this process. But we need every citizen's help here. We need to make sure that you are maintaining that social distancing that's required and that's been suggested by CDC. The way we're going to be able to keep those parks open is if everybody complies with those requirements that have been set forth by the state and by the CDC. We will also be closing down the portions of the parks related to playground equipment and things of that nature. But if you want to get out to a county park, hike, bike, do whatever, it'll be open for those purposes. And we certainly have a lot of beautiful parks throughout the county and encourage you to get out and get some mental sanity by using those. You know, I understand right now feelings in the community are stressed, that's for sure. There's some people, I've had a lot of feedback from my constituents. Some people are frustrated that the governor has come out with an order asking people to shelter in place. And I've had other people that have reached out to me frustrated that an order hasn't come in sooner. And I get that we're in a circumstance where lots of people have a lot of feelings on all sides of this issue, whether you think it's too much of a deprivation of liberty or where you think that we're not doing enough to keep the public safe. I understand that there's a lot of frustration out there. But I'll tell you, and I'll tell you, I've also been a little bit frustrated in this process as well. I wish our governor would do a little bit better job, quite frankly, of communicating with local elected officials. You know, in El Paso County, we are one of the 2 largest counties in the entire state of Colorado, and certainly we want to be doing our part to be able to help the governor successfully navigate this. But the best way we can do that is to be in constant communication with them, providing suggestions. We have a tremendous number of leaders that are experts in their areas that I think could be providing a tremendous amount of leadership and resources necessary to help us manage this moving forward. And we'd also like to know what's going on before it gets to the press conference so we can adequately push that information out to the citizens of El Paso County as well. But at the end of the day, we're all in this together. It's going to take every single one of us in this room, everybody that's online, everybody that's watching on a TV right now. It's going to take all of us together in order to manage this crisis and to make sure that we come out on the other side of this and we come out successfully on the other side of this. So just a couple of suggestions for you. Channel all of that energy and emotion right now into helping each other out. Again, we're all in this together. Give that support to your loved ones, your family, your neighbors, and your friends. If you pick up groceries for a senior citizen, do that. Drop them off on their doorstep. If there's somebody else in your community that has some sort of at-risk need, help them through those times. I believe the best we can do when we're in these frustrating and challenging times, these times of unknown, take as much control as we can, and that means helping those out that are close to us. And again, reach out to those that are most at risk. Help them find the groceries they need, get the other services and resources they need. Be understanding and patient with each other. I think that's especially important now as we're locked up in our homes with people for days on end. And most importantly, if you get out to the grocery store, please, 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 only take what you need. We do not need people hoarding at this time because you put somebody at risk. You might have a senior citizen out there trying to find what they need, and they can't find it in one store. They got to go to another. Can't find it there. They got to go to another. They can't find it there. They have to go to yet another. That only puts them more at risk. We don't need that at this time. Again, we're all in this together. Take only what you need and make sure you leave the rest for other people. I think if we do these things, we're going to see a light at the end of the tunnel sooner rather than later. We do what we're supposed to do right now. We take this seriously. We are going to get through this just fine. Next, I'm going to turn it over to Dr. Johnson. I believe that we have her on the phone. I don't know how we're going to bring her up on the phone, but Dr. Johnson, can you hear us? Dr.
Yes,
Johnson?
I'm here. Can you guys hear me? So,
I think we have you. Dr. Johnson, are you there?
Commissioner, this is Dr. John.
Please proceed.
Yes, I am. Thank you. Thank you for asking me to join you today. I am doing so remotely, so I am working from home.
Dr. Johnson, please stand by. We're not getting you very clear at all. We'll try to figure out another way to bring you up here.
Stated, we are all in this together. Okay. Absolutely. Thank you.
Hello, good afternoon. My name is Dr. David Steinberg. I'm the Associate Chief Medical Officer at UC Health Memorial. Actually, I work quite closely with Dr. Johnson as well as with my cohorts across the street there at Centura, Dr. Bill Plouth and Dr. Erling. We're actually all in this together. What Dr. Johnson will undoubtedly say is that it's really important for us to listen to the rules of staying in place. What we've noticed is that those societies that took this very seriously early on recognized that the rate of spread is tremendous if you keep people together and keep them shedding the virus without even knowing it. The problem is as that rate rises very rapidly, there's a smaller portion of that group of people in our society that will get very, very sick, and that will overwhelm our hospitals. So what we've been doing in conjunction with the other hospital systems and up and down the Front Range has been stopping elective surgeries, has been pushing back those things that we can delay. We don't stop them forever, but we try to delay them as much as we can, and getting ourselves in a position where the hospitals are ready to take a surge of very critical patients if possible. We don't know exactly what that looks like, and we're trying to model with the Public Health Department about what that is based on data as it comes in. But we believe strongly that by doing this social distancing, by staying at home, and by doing the things that we're being asked to do right now, we are going to be able to ride this out much more effectively and be able to save those citizens who are at most at risk of getting extremely sick. There will be some young people, but there will be a far number more of older people with other medical problems who could get extremely sick, and many will die if we're not careful. If we can control that and keep those ICU assets available, we can do much better throughout this. On behalf of all the medical establishment, I apologize for what we are asking you to do, and I thank you for what you are prepared to do. This is a community that understands shared sacrifice and understands that we are all in this together. And this is probably the true test of our mettle and our character, but we will get through this because we will do this together. Thank you.
Thanks. My name's Brian Erling. I'm the CEO at Penrose St. Francis Health Services. Echo all these comments. Just add a couple other points. Also very grateful to everybody and the sacrifices that you're going to be making in the community. It's a big deal, but it's absolutely important. I'm going to give a little bit of the state of the hospitals right now, just a little bit, but I want to start by thanking all of our caregivers in healthcare. The sacrifices that they're making on a daily basis is impressive. So all of our caregivers at Penrose, at St. Francis, at UC Health, Children's Hospital, all the outpatient clinics, all the other healthcare providers are really making major sacrifices. The effort that goes into taking care of patients that are COVID positive or suspicious for COVID is a big deal. So we've done some strategies that Dr. Steinbrenner touched on together collectively, delaying elective surgeries, going into a mitigation strategy, as we call it, around who we test, has been a big deal. Where we are right now is that's working. Our hospitals are running right now at about a 60% capacity by canceling a lot of elective surgeries, and we're doing only about 10%, 15% of what we would normally, normal procedure counts. And that has allowed us to really decrease the number of patients that can be postponed and not in the hospital. So again, we're at 60%. We have units that we have essentially shut down that we are ready to surge up when the capacity is needed. In many ways, we sort of are likening this to the calm before the storm. The big question, though, is, how big a storm is it going to be? And we believe that with all the strategies that we're putting in place as a community, that we can keep that storm to an absolute minimum. Some things that you can do in the community. We are definitely running short on personal protective equipment, as is essentially every community. We have the ability to accept donations at Penrose Hospital. There's actually a drop box right outside the hospital. We've partnered with Project Cure, which is a fantastic organization, along with UC Health and Children's, and they'll be running a PPE drive this Sunday at UC Health. Most importantly, we collectively, the health systems, are here for the community. You are going to be safe. You are safe in our hospitals, most importantly. And please rest assured, if we are all conscientious during this time, we're going to come out of this just fine. Thanks.
Thank you so much to all of our speakers today. Thank all of you watching at home and our media for our temporary technical difficulties. We're all trying to leverage communication in the most efficient and safe way, and we're kind of working the kinks out right now. So we will take questions right now. We do have questions coming via text to Andy Sinclair and on Facebook Live, so we will go in between questions in the room and our questions coming in virtually. So we are fortunate to have a great number of experts up here. Please help us out and let us know who your question is for.
Operation is working, and if there are and do more from
That's a great question. I think the fact of the matter is, at least the hope is, that a stay-at-home order kind of escalates in people's mind the seriousness of what we're talking about. I think it's safe to say, and Karen, feel free to jump in, if that most of the vast majority of our citizens out there have been in compliance. People on the trails are staying away from each other, things like that. I would say, if I was to point out anything, we've had quite a few young people. They're out of school. Their parents may say, they told their parents they're going to the park. What happens is an impromptu basketball game that is clearly in violation of the distancing suggestions and now orders. And so I think we'll get more attention, and I think we feel pretty good about our level of compliance. As we've indicated, we'll have park rangers in the parks, and we'll also put police officers who would otherwise be in our schools will be in the parks, and we'll be talking to those young people, and my guess is we'll get a pretty high level of compliance.
There's so many aspects of this program.
Well, as I say, I don't think we're in a position for Chief Niski to put people in the grocery stores with 6-foot tape measures and things like that. And I don't think we need to. I think people, the vast majority of people are taking this seriously. I think if there's an indication that there's a crowd at an event in violation of this, I'm sure we'll respond to it and hopefully break it up. If not, then we'll escalate in the fashion that I talked about. But I'm pretty confident that we'll get widespread compliance. If not, we'll escalate as necessary to do what's necessary legally to get compliance.
Thank you. I've been reminded by our friends on Facebook to everybody please repeat the question so they can hear as well. So, yes. So the question is, how are the hospitals deciding who will and who will not be tested?
Yeah, and I think we're going to tag team this one because we've approached it a little bit differently. When I referred to us being in a mitigation strategy, part of it was testing. So, excuse me. We had, just clearing my throat, not coughing. When I had, so patients that were coming into the emergency department, we started to get inundated very early on, and it wasn't so much capacity, it was test kits. So we were only testing those patients who were sick enough to be admitted to the hospital, from our hospital. Now, you can still go to different areas in the community with a doctor's order and get tested, but part of that is, we have, for example, more than 50 patients in the hospital right now who we're waiting to get a test result on. Average is 7 days, and we have outliers that are more than 10 days waiting for a test result. In that process, we're using PPE on these people every day, and we don't need to be on a fairly large percentage of them, but you don't know. So we've taken a very conservative approach with those, because we believe that the tests really need to, until we have tests that are turning around more rapidly, and we're starting to get those tests availability, or those tests are starting to become available, we needed to really conserve them for the patients that are being admitted to the hospital. Now, we have community testing available, and I'll actually let you speak to that.
Sure. So everybody's testing based on their capacity to bring resources to the fight, so to speak. Early on, there was a real crunch with testing, and going into CDPHE, they had a strong backlog as they started to put a lot of tests out. What we've started to do at UC Health is try to amp up our ability to get tests done, but we still reflect the need for the tests. So if you come in and say, I've been exposed, and you have no symptoms or have mild symptoms, it's not going to change my management of you. I'm going to say, as this crisis and pandemic goes on, you probably have it. Go home, stay home for the 10 to 14 days, probably 14 days, while the process goes on. Make sure that you're symptom-free and practice self-isolation. No change in your management. Now you come in, you're very sick. I need to really know whether I have to use that PPE that's so precious. And so what I'll do then is test you as you come into the hospital if you're being admitted. Now, we've been able to expand it a little bit within our system at UC Health to sort of help out and try to get those people coming into the community who are healthcare workers as well, who we're going to put back on the front lines. And they will try to do the same before they put somebody out on the front lines to make sure that they're free and clear of this virus. So we are trying to increase our testing capability, but still have to be very careful about what we do and how much we do so that we don't exhaust that resource and now I can't use it for the people I have to use it on that changes their management. The question is, does age play a factor in that? Do we take elderly people at higher risk? We take people who are at higher risk. So age is part of that risk factor, but there's also those that have pulmonary disease, they have cardiovascular disease, who are going to be at higher risk as well, who are being hospitalized, and we're having to say, look, this person really meets criteria to get tested. And this is the same across the street as well. So as this goes along, the younger, healthier people that show some symptoms, we'll say isolate. Remember, there's a reason to do this, because remember, you're young, you're healthy, you get the disease, you do okay, perhaps, not all, but most, but you pass it on to somebody in your family who is more at risk, and you put them at real risk because you were not practicing social isolation and following the rules.
Mary, go ahead. So the question is, could the hospital officials provide a total number of cases in the community, total number of available beds, and the possibility of alternative facilities?
We're actually reporting our numbers to El Paso County Public Health, and just for simplicity, we're going to let them be sort of the arbitrators of the data. How many we've had in the hospital, how many have tested positive, how many we've discharged, because we discharged a bunch of people who were positive and who got better. I'm not going to provide exact details, but again, El Paso County Public Health has that information.
Yeah, and as the mayor mentioned, it changes, so they publish it. So the best source of that truth is to go to El Paso County, because we have to go to the public health department and determine that number. So alternative sites depend on what you need them for. So countries that have had, like in China, they actually put alternative sites for people to stay who are positive but not very symptomatic, for healthcare workers to stay. That's a very different lift than we're going to do here in the United States. So what we've asked people to do is to isolate at home and shelter at home to sort of give the equivalent of an alternate site for you to be. For hospitals themselves, we both have surge plans that are very robust for the ICUs that can ratchet it up based on what we're seeing a few days ahead. So we work on modeling plans to say, what are we looking at right now, based on what we're seeing, what it's going to look like in 3 to 5 days, and what do we need to have available? And we've been rapidly getting vents and getting more doctors redeployed. So if you're a doctor who's out of work because right now your elective cases have been canceled, then we can put you to work doing something else. And we're working on those plans as well. And both systems are actively working on that plan, I'm sure. And so we're always working contingency plans based on what it looks like as it comes into the hospital, so that we're prepared for whatever comes at us. But the key, as I said before, is to make sure we flatten that curve and make sure that what comes at us is something that we can handle.
I'm going to take just a second and work on the microphone issue here.
Test 1, 2, test.
Okay, we'll go ahead and continue. Go ahead. So the question is, what is a message to the community to ease the stress of El Paso County currently leading in the number of deaths?
That's obviously not an easy question to answer for folks. We have an older population with, and that older population does have some pulmonary and cardiovascular and other comorbidities, as we call them. So it's certainly possible that part of what we're seeing is related to the fact that those that have gotten it early, in fact, one particular cluster, were more elderly, and they had other medical problems as well. That being said, we do want people to think about the population around us. Remember, we are doing these things to protect those that are most vulnerable. It's not just that I will get it and get very sick. It's not just that my family might get it and get very sick. It's that I might pass it on to somebody else who really cannot afford to get sick. So I think the way to think about this is cautious optimism that we're testing people and starting to find out how many people actually have it as a percentage of the population, that we're taking care of the sickest, and that in that there will be some who are going to succumb to this virus. But if we can control the outbreak, the speed of it, and the rise of it, then we're there with those resources to make sure that they can get through, give them the fighting chance to get through this.
The first question was, were there more confirmed cases from the bridge tournament? Unfortunately, I think that's an El Paso County health question, and we had them remotely, so we'll have to pass that question along. The question is, did the city or county know about the stay-at-home order before it was publicly announced?
The city did not.
No, that's been one of our frustrations. We had no knowledge at all. The first time we heard about it was when we saw the press conference everybody else did.
Yes, they can be subject to criminal prosecution. Mr. May, the district attorney, is sitting up there, and he's been in conversations with the health department, and they have agreed upon an escalating system of warnings. And if someone resolutely refuses to comply with those warnings, then it will be the subject of criminal prosecution.
Are there any more online or in the room? Yes. The question is about the number of deaths and the connection to the bridge tournament. We can certainly reach out to Michelle Hewitt at El Paso County Health and get you an answer. If that's all. Oh, sorry, Scott.
So, where do you all feel like in the progress of this whole thing?
So the question is, where are we in the progression of this virus for the hospitals?
Did you repeat the question for them already? Okay, so that's the big question. We're trying to look at other parts of the country and figure out how many weeks ahead we are from, say, Seattle. Not that we'll have the reaction that Seattle had if we do this properly in terms of distancing, but just thinking, could we be at that stage? And if we're a few weeks ahead, what does that look, or behind, what does that look like? The county is currently, or I should say the public health department, is currently modeling this every day, and they're refining the model based on the data that we get from El Paso County and from the hospitals. And so we'll have a much better answer about where we are in this. 2 weeks behind those other areas I've heard as a possibility. And then what that looks like uniquely for us just depends on how proactive and how effective we are reacting to this. But that's about where we are. So you can look into the future by looking at other places that are further along in this epidemic, or pandemic, I should say.
The only other thing I would add is when we look at the preliminary models, that we're in much better position than some of the other states that have seen a marked increase. And I think we can attribute that to what everyone's been talking about with the fact that this county and city has been very proactive in the social distancing, shutting down the larger gatherings, and it's really made a difference. But again, we're in the beginning stages of this, and so we need to continue those measures to make sure that we're still successful. We still have that very flat curve that we otherwise can handle as a healthcare system.
Do you feel like it's going to get worse?
Oh, yeah, absolutely. That's the whole point of what we tried to do by shutting down elective processes, by emptying the beds in the hospital that we didn't need patients in, by trying to get people not to come to the emergency department if they didn't have to. We're just preparing for what we know is going to get worse. And if we're able to make that less worse than other places and not as bad, then we've done our job as a society. So the question was, has anybody done a number crunch to look at best or worst case scenario for El Paso County? We do that daily right now. And so the people who really point on that are public health. And so currently the public health department and their epidemiologists are working very, very hard at putting together a model that's reliable, and that every day they take the data that we actually have and change the model so that it's more accurate. And so they've got a wide range of numbers based on worse, and so far we're hitting the mark in terms of the numbers we're seeing, but it's at the lower end, fortunately. So obviously people are doing a good job. And I want to kudos to the people of Colorado Springs, El Paso County, Teller County, and the surrounding areas. They've done what we've asked them to do. And we know this is not an easy lift.
I'm being signaled that we have questions on Facebook Live. Ryan? The question is, can retail businesses sell online with curbside pickup?
We're talking about non-restaurant, right? It appears in reading this, and I did my lawyer inspection of this, it appears to me that for the most part, they can take online orders and deliver, but they can't of just retail products, not critical medicine or food or anything like that. And they have to, after they take the orders, they have to deliver the product. Anybody have a different view of that? Okay.
Okay. I think with that we will close. Thank you so much for coming today and helping us get the messages out.